Eyelid twitching. Causes, symptoms, and when to see a doctor. Eyelid twitching, medically known as myokymia, is a common, usually temporary, involuntary movement that typically affects the muscles of the eyelid. Most people experience eyelid twitching at some point in their lives, and while the sensation can be uncomfortable or a little distracting, it is usually harmless. However, for some people, twitching can become frequent or persistent, raising concerns about underlying health issues. In rare cases, prolonged eyelid twitching can be associated with a more serious condition, such as facial palsy. Understanding when an eyelid twitch should be considered benign and when medical attention may be needed can give you peace of mind and ensure prompt intervention when necessary. Eyelid twitching is usually caused by the spontaneous contraction of the tiny muscle fibers around the eyelid, usually due to lifestyle factors or minor physical irritation. Some common causes include: stress is one of the most common causes of eyelid twitching. The body's response to stress releases a variety of chemicals and hormones, including adrenaline, which can cause physical reactions such as muscle twitching. During high-stress situations, the body becomes more sensitive to minor triggers, and the muscles around the eyes are particularly sensitive, so they may twitch. Lack of sleep can disrupt the balance of neurotransmitters that help muscles function smoothly, leading to problems such as eyelid twitching. Fatigue-related twitching is common in people who have irregular sleep schedules or are chronically sleep-deprived. Additionally, poor sleep quality can exacerbate twitching because the body cannot recover and repair properly. Both caffeine and alcohol can affect the nervous system, which can cause eyelid twitching. Caffeine in particular acts as a stimulant, boosting energy levels by affecting the central nervous system, but it can also overstimulate muscles, causing involuntary twitching. In today's digital age, eye strain has become increasingly common. Excessive use of digital devices, prolonged screen time, and low light levels can all strain the muscles around the eyes. Not only does eye strain cause discomfort, it can also cause the muscles around the eyes to involuntarily contract, which can lead to twitching. Dry eyes are common in people who wear contact lenses, stare at screens for long periods of time, or take certain medications. When the eyes are dry, they become irritated, and the surrounding muscles may twitch in response to the discomfort. While most eyelid twitches are benign and temporary, it is important to understand the context in which the twitch occurs. There are several types of eyelid twitches, each with unique characteristics and potential mechanisms. Identifying the type of twitch helps determine if it is likely to be benign or require further testing. Myotonic twitches are the most common type of eyelid twitches. It usually affects the lower eyelid, but can sometimes affect the upper eyelid. This twitch is usually mild and temporary, lasting from a few seconds to a few minutes, but in some cases may continue on and off for days or even weeks. Myotonic twitches are almost always harmless and are usually triggered by factors such as stress, fatigue, and eye strain. Benign essential blepharospasm is a more severe eyelid twitch that affects both eyes and can cause spasms severe enough to temporarily close the eye. While benign essential blepharospasm is a rare condition, it can be debilitating for sufferers because the violent spasms can disrupt vision and interfere with daily activities. Unlike myotonic twitches, benign essential blepharospasm does not resolve on its own and may gradually worsen over time. Hemifacial spasm is a neurological condition that affects one side of the face, including the eyelids. It usually starts with a mild twitching around the eye and spreads to other muscles on the affected side of the face. The condition is usually caused by irritation or compression of the facial nerve, usually caused by a blood vessel. Hemifacial spasm is a more serious condition that may require intervention because it causes persistent twitching and muscle contractions on one side of the face. In most cases, eyelid twitching by itself does not indicate facial paralysis. However, when it occurs with other facial symptoms, such as weakness, drooping, or difficulty with facial movement, it may indicate a problem with the facial nerve, which controls muscles on both sides of the face. Facial paralysis can be caused by a variety of reasons, including viral infections, trauma, or neurological conditions. One of the most common forms of facial paralysis associated with eyelid twitching is Bell's palsy. Bell's palsy is a sudden, temporary paralysis or weakness on one side of the face that is believed to be caused by inflammation of the facial nerve. It causes the eyelid and mouth on the affected side to droop, as well as difficulty blinking and loss of facial expression. Some people experience eyelid twitching a few days before Bell's palsy strikes. The condition usually resolves on its own within a few weeks to months, but treatment may include the use of corticosteroids to reduce nerve inflammation. In rare cases, facial paralysis may be caused by a more serious neurological condition, such as a stroke, which disrupts the signals to the facial muscles. Tumors or trauma that affect the facial nerve can also cause paralysis, although these are less common. Symptoms such as muscle weakness, numbness, or drooping associated with eyelid twitching may require immediate medical evaluation to rule out more serious causes. When eyelid twitching becomes frequent, persistent, or is accompanied by other symptoms, a visit to a healthcare provider may be necessary. Diagnostic steps typically include a detailed medical history, a physical examination, and occasionally specialized testing. If the twitching persists or involves other parts of the face, a neurological examination can evaluate reflexes, muscle strength, and sensory function. This exam helps determine if the twitching is limited to the eyelid or affects a larger area of the face, which may indicate the presence of a condition such as hemifacial spasm or Bell's palsy.